a little while, 2 days ago, so you guys have a sense. I think the most important thing of the CTSI is that we are disease agnostic. So that's why I asked Steve, that's our charge. So we help everybody as part of our charge. We're based out of a medical center. We certainly extend our services to Gable, to a university-wide center, university-wide resource. So that's important. I'm just going to highlight, rather than explain to you how we're structured and organized, a lot more about some specific services. I'll increase awareness of some of the stuff we do. Audrey, Steve, Sarita, I was just talking. It'd be nice to have these talks all together where there's so much overlap. I think it's important that we have, and Erin and I, Erin Kovitz, I'll show in a second, is the co-director of the CTSI with me, have a central place that people can go to this because there's a lot of overlap to organize and put it together. We formed a committee. I heard, the research cabinet, that's what we're talking about because, so it's, yes, we need to better structure this thing up institution-wide. That's our leadership team. But Erin Kovitz, who a few months ago was vice provost for research, but really it's a team of 4 people. We do a lot of different stuff. I'm just going to give you a slightly overview, service-oriented, so specific services rather than comprehensive, because it is really a lot of stuff. So one of them, I'm not going to talk a lot about this, but one of them is obviously career development education. And some of the highlights, if you guys are interested, is our Master's in Clinical Translational Science. That's a 30-credit course. And many people take it, whether faculty at the university, and they just keep getting it because of the faculty credits. And they're able to, over a couple of years, get their Master's in Clinical Translational Research, assuming your chair or whoever it is allows you to do this and take the time to do it. It's one of our big things. We also run, we think of for ourselves, faculty researchers, but actually it's a research staff that does all the work for us. And so we have a network of clinical research professionals. They're the ones that we really want, to foster and support. Aida is one of our clinical research professionals up in our core, another core for the Cancer Center, but they're the ones that really get stuff done. And so we have seminars and trainings for them, and I'll talk in a second about one of them. So that's some of the general training activities. So the first one that we get a lot of is informatics help. People come to us for informatics. How do you get data from UChart? How do I put it into REDCap? How do you do this? So we do have a lot of educational workshops in informatics, how to do this stuff that we spoke to before. If you're part of our listserv, and I'll give it to you at the second, you will get an announcement of these. Example, REDCap, importing your data from UChart, those kind of things. But some of the big ones that we do is the REDCap. So we developed that and supported from Vanderbilt, and now it's a university-wide resource. So that was something we started. So a lot of training on how to use REDCap and resources. Most recently, one of the big ones is everyone wanted data from Jackson. And, that's a major, major problem and how to get it. We developed, and we, Erin Kovitz, took 5 years. She finally got Jackson to agree to put the data in a third party hosted and a way to able to do either cohort discovery, see how many diabetic patients are followed at Jackson, or very basic questions like that. So now there is a solution to be able to, quote unquote, do data queries from Jackson. You still have to go eventually if you want to get their patients through all the institutional barriers, but at least now you could get the identified data from Jackson, which was a major challenge. And we also provide, not for probably, but people that are doing like genomics or something like that, large data storage needs and things like that, we do provide the consultations on it, how to get that done at Data transfers, a lot of us participate in large studies, and we need to upload data into big repositories, and so we have solutions for that as well. Not all of this is free, by the way, I just want to make clear. We meet, we do the consultation, price it out, and then let you know, but at least explain how the process works for a lot of that. These are 2 tools we have, and you heard this recurrent, but obviously recruitment is a major thing here. And one of the things it's named also, we call it consent to contact, but it's slightly different. Any patient in the health system, and I spoke about this last time, but any patient that comes to the University of Miami Health System gets asked, do you want to be contacted for research? So we maintain that listserv, and if you want it, you reach out to us and give us the criteria. We have consultation with you, and then you get these little, these are the patients. And then for patients that are not UMiami set patients, and this is a work in progress, is the UMiami Health Research Portal. And those of you that work with things like clinicaltrials.gov understand, even though they just recently made it better, that's totally not patient-friendly. None of the descriptions there any patient would understand. This is a way, it's a lay-friendly tool in a way that people can understand. And you could have two choices. You can either sign up to be contacted, or there's a list of studies there, and we vet those studies. So we investigate, you want to put your study there, we work with you to translate it into something human beings can understand, and then they can decide whether they want to participate in that study. So those are two of the resources we do maintain. I don't think many of you have heard. How many of you have heard of One Florida Clinical Research Network? We're part of that. We upload data into One Florida from UHealth. It's basically a super macro electronic health records of several institutions across Florida. Those are all of them, including non-academic health centers. They have over 50 million. Now they include data from Emory, from UAB, as well as, I forgot the newest one that joined. But it's a repository of EHR data that you can access. They use something called I2B2 that you guys may not know. So we have tutorials, how to use it, how to access it, and there's problems. But you do have access to EHR data from a lot of varying institutions. Started with Florida, but now it's grown very big. That's another resource we support. The one everyone wants, biostat support. That's what most people come to us. And again, we don't provide free biostats services. It's not like you could write the CTSI, but we do a lot of things for free. One is consultation. So if you're developing a grant, we pay for that. And so it's free, and they'll help, write your biostats section for you. So going to the grant, but of course, the quid pro quo is you have to put their statisticians in the grant after that. But we provide that. There are office hours. If you guys have pesky questions, I forgot one of the studies we just did, and we had to do some indirect adjustment for, is it age? I forgot. But we went and, hey, this is how we did it. Is this correct? They looked at it. They looked at our programming. Yeah, that's right. That makes sense. So that kind of quick and dirty office hours, that is free, and we support. And then if you're UM and you're part of the research listserv, you probably see the biostat seminars that we do run. So that's another important resource that we do provide. Let me see. Yeah, so the most popular, the K-12 program. We only issue 2 awards, and it's every 2 years, but it's 75% of the time. Highly competitive. You got 2 years of protected time. Someone wants it, but our pilot award program, it's about $40,000. We award 5 or 6 every year. Really do it. And then we have something called the K Connection. A lot of the faculty doing K awardees or other postdocs or things like that. It's sort of like a listserv, and we have some events for them where they all participate. They can all talk. How do you do this? How do you do that? The usual stuff that networking is really important to. They all communicate with each other. And again, let me see. I'm just trying to do this. I'll skip our planned activities. All right. The last one is research grant and consultation support. You've heard everyone else do this, but we also have this. And again, disease agnostic, where you receive personalized mentoring. Alan Delamater, who's really great, does most of these. We do the grant writing course for the MSCTI. We do have videos online, practical steps by steps on how to write, let's say, a K award, which is different from an R, let's say, or something like that. Really cool. I did not know UM provides this. We have a writing center that actually reviews your grants for what I'm very guilty of, grammar and other, spelling, grammar, basic English kind of things. It's run here by the Gables, by the UM Writing Center. And we'll arrange for those consultations, and they'll look through your grants, and it's just written in. What? Yeah, that's free apparently, right? I did not know. We provide, we do the linkage, but the center here does it, and it's free. And I was like, wow, I didn't know that.
I've worked with the writing center before. It's really great.
Yeah. So you come to us and we link that to it. I wish I knew about their existence. Like Steve said, I am very guilty of that part of it, many of my grants. So that's it. And then we're kicking off our grant writing workshop. You probably have seen it. Let me see if it's in the next slide. Yeah, you probably saw this already. It's coming up now in the fall. It has several sessions on, how to write your specific games, how to do this. Again, we do one-to-one, but it'd be really nice if people first take the overall grant writing workshop. And if you do the grant, then he will committed to helping with you all along your process of grant writing it. And I think that's it. We have some other stuff. We're trying to find out how to use AI to write grants, basically, and then make that tool available. It's something everyone is doing now, apparently. Apparently now people are getting their background sections written by AI, and then they go back and they re-edit it. But we're trying to learn more about that and how it's used. A work in progress, but apparently it's something everyone knows about and is doing except for me. So it's really helpful. And Steve talked about this, but this is a new one that we're planning to do, which is on budgeting and contracting. One of the most challenging things I think for junior people like me, especially when they negotiate with industry trials, people just don't understand how to budget things. So a lot of times the recruitment, they come to me for recruitment advice. I'm having trouble recruitment. And the problem is they didn't fund for recruitment. The recruitment strategy was I'm going to post flyers in clinics, which we all know doesn't work, and that's it. Or I'm going to get a medical student to go to the clinic and recruit. We're like, no, that's not a recruitment. Where's your recruitment budget? And the other thing people often don't know is PI budgeting time. The PI time, you really have to budget for that. And many people don't know how to do that. They put themselves in for 5% because make the budget big. Like, no, then you cannot cheap out on your own time. So that's something we started already doing it with our internal people. They find it extremely helpful to sit with somebody that actually knows about budgeting, how to do realistic budgets on grants, and when it doesn't work, when just your budget doesn't work. And then Denise Vidal from our School of Nursing runs our community-based research support, but a lot of you do a lot of community-based research, but some people don't know how to do a CAB. How do you do a CAB? A nice little sample MOU. How much do you pay CAB members? How do you decide that? How do you get the vendorization? How do you get them vendorized? Stuff like that that we all struggle with. We also provide help and advice on that. All those nitty-gritty kind of things that are a pain in the butt to deal with for all of us. All right. Yeah, like Steve said, this is it. It's on our website, but we will talk. I got to talk to Steve. I got to talk to Steve. How to really make, there's got to be a way to link in this one-stop shopping. I know the Office of Faculty Affairs wants to do it through them. OVPRS wants to do it through their website. We got to find a way to put this so it's really accessible to everybody here so that you are aware of all these resources. And we'll figure it out. Yeah, that's it. Yeah. I propose have it in all of the sites. So that was my solution. Yeah.
We are having this like.
Yeah,
Twice a year meeting.
correct.
Sheila Dominguez came to it.
Yes.
Yeah, so.
We should do it. Yeah, I mean, you guys know me. I'm like, do it, don't talk about it, do it, and that's what I would. Because at UM, you could get, it's like getting wrapped up and all the why you can't do it instead of just doing it. The what? No, that's all free. Yeah, that's all free. Yeah, that's all free. Yeah, consent to contact, research registry, if you want those. Yeah, that's all free. Yeah, I mean, what people want, I mean, the two things I find that we can't support, they want ongoing biostats consultations, and now it's informatics. Everyone's ongoing. That's expensive. That costs money. Biostats has quite a lot of bandwidth, but our research informatics department still has a very tight bandwidth. That's a challenge. We're trying to work with them.
I have a question. You mentioned about the AI use of writing in the grant.
Yes.
So if I write a grant and do the AI and then go back to the humans and then you correct. And then I submit a grant and you are the reviewer. How do you react? Is human or AI? How do you react to that grant?
I've never done this. I don't know how to do it. We're figuring out, we know everybody apparently is doing this, which is news to me. And so we're trying to figure out and provide investigators guidance and how to do it, right? Presumably, you're not gonna write in your grant that you've had a develop your grant for you. You won't do that, but it is a very area. I don't know, Steve, what have you heard? Savita, apparently this is what people are doing.
I use it for statistics.
Yeah.
And it's really good, like, if we're, and my students too, like, if we think we know what we're doing, like programming in R or SPSS even, but like, tell it what you want to do, it'll tell you. Then if you need help, like interpreting your output, or, I get tripped up sometimes, like with odds ratios and risk ratios and how to put it into lay language, and you just tell it, and then it spits out like exactly how to say it,
So I don't, so the answer is I don't know, but apparently, stuff like this, right? It'd be nice if you have a repository to help people. This is where, Steve saying, this is where I found AI to be really helpful in developing my grant proposal. Apparently people are doing it for background sections. This is how I've used AI to help grant.
I've heard it sucks for that.
We need, so we need some kind of institutional, so that's a plan, because everyone keeps asking us how to use AI to write grants.
You have to know the subject yourself. You
Yeah,
can get
yeah.
AIs.
Yeah, I mean,
But-
AI
but
could
they
be
can make
terrible. Yeah,
mistakes.
AI could be terrible.
Yes, you
I
really
would
have
never
to know
use, but I think what I'm hearing is what I'm saying, we need guidance on this, right?
Yeah.
We can't let every person out to the wolves on themselves. If Savita said, it's terrible for this background, so this is what you would need to do, and somebody else says, well, this is how everyone is asking us for help, and I'm like, I don't know.
My question is, if you are a reviewer of the grant, how would you react?
You won't know. How would you
Well, I mean,
know?
you're not gonna tell the person using AI to do this, right? However, like happened in this legal case, right? They were making up citations, right? If you know that field, if you know HIV, and somebody studied, hey, these are the 3 studies that showed, I don't know, that the HIV is effective in
Know your
humans,
area.
and Savita knows this is made up, this doesn't exist, I mean, but that is, I mean, the thought is, again, this is something desperately needed by the community, and we're trying to be responsive to that.
Fair.
All right. Who's next? Thank you, guys.
JD and I are gonna be super fast. There's not, let me see. So you want me to stop the recording? Okay, sorry. I thought I could do it.
One more AI tip while we're waiting.
Yes.
Always be nice to ChatGPT. I'm just saying.